Over the weekend, President Trump was seen wearing a face mask for the very first time publicly. This comes months after most Americans began wearing face coverings to prevent the coronavirus from spreading. Ahead of his visit with wounded service members at the Walter Reed Medical Center, the president told reporters it is, quote, a great thing to wear a mask, adding, I believe they have a time and a place. On Face the Nation, moderator Margaret Brennan pressed Surgeon General Jerome Adams about why he's changed his stance on the benefits of face coverings.
You are wearing a mask. You are clearly trying to make a point. At the beginning of April is when the administration started telling the public to wear masks. But just the last time you were with us here on Face the Nation, March 8th, you said this. Let's listen.
And stay safe by washing your hands, by covering your cough, by staying home if you're sick. Masks do not work for the general public in preventing them from getting coronavirus.
Right. And the week before that, you tweeted in all caps, seriously, people, stop buying masks. You said they were not effective. Do you regret saying that?
Well, it's important for people to understand that once upon a time, we prescribed cigarettes for asthmatics and leeches and cocaine and heroin for people as medical treatments. When we learn better, we do better. And the WHO,
are you saying
the CDC,
at that time you did not know because the CDC in February was looking at asymptomatic transmission of the virus?
We were looking at that, but the CDC, the WHO, and even in May, there was a New England Journal of Medicine article that still disputed whether or not masks were effective. We've learned more about asymptomatic spread. Up to 50% of people who can spread this disease spread it without having symptoms. And that's why the American people need to know that science is about giving the best recommendations you can. And
yes.
When you learn more, you change those recommendations. Our recommendations have changed.
Okay.
Now, people of America, important to know you should wear a face covering.
And we certainly do.
When out in public.
We certainly do take that advice, but I think you have to acknowledge that this mixed messaging has created confusion, and it has drawn into question some of the credibility of the administration. Are you certain
well, and
that
we're trying
this
to correct
wasn't
that
just
messaging,
done
Margaret,
because
but
of a
it's very hard to
shortage
do.
Well, I'd like you to clarify it. Were you saying that then
yes.
because there just wasn't enough equipment?
I was saying that then because everything we knew about coronaviruses before that point told us that people were not likely to spread when they were asymptomatic.
For more, Face the Nation moderator Margaret Brennan joins us now from Washington. Hi, Margaret. You pointed out that the mixed messaging coming from the White House, particularly in regards to face masks, has created confusion. And then this weekend, we saw both the president and the Surgeon General on your show publicly wearing face masks. Does this indicate that there's a policy shift in the administration's approach? Is this deliberate?
Oh, it's clearly quite deliberate for the Surgeon General to wear the mask during the interview. He wants to make the point that this is necessary. It is also very deliberate that for the very first time, the public saw President Trump wearing a mask. You know, we'd heard he'd worn them in private, but he allowed for those photos to be taken because they are trying to clearly send a message that masks need to be worn, particularly because they are seeing these spikes